Dr. Brandon here with ImmuneStrong Kids. The question we are answering today is, how can I naturally boost my children's immune system? What can I do that will naturally strengthen and improve the health of my child's immune system? And I think this is a particularly important question because as parents, we face some problems. One of those problems is that it's becoming more and more common for children to be sick more often and have more severe cases of cold and flu. And flu season kicks off in the fall and really lasts all the way until the spring. Usually the highest number of cases of flu is in February, and then flu season usually kind of tapers off in March. So this is a question we spend a lot of time thinking about here at ImmuneStrong Kids, because the mission of ImmuneStrong Kids is to help parents raise healthy kids that have strong immune systems, that don't get sick often, and when they do get sick, they recover quickly. So what can we do that will naturally boost and strengthen our children's immune system? By far, one of the most important things you can do is vitamin D. Vitamin D is the immune system vitamin. Now, we know that vitamin D is important for all kinds of functions. Virtually every cell in your body has vitamin D receptors, which means that vitamin D influences the function of virtually every cell, organ, and tissue in your body. But in particular, vitamin D is important for every facet of your immune system, from regulating inflammation to helping to defend your body against cancer, and in particular, defending against infections. In particular is what are called viral respiratory tract infections. So VRTI, viral respiratory tract infections. Respiratory means breathing, right? So your mouth and your nose, your throat and your lungs. That's your respiratory system. And a respiratory tract infection is things like the common cold, flus, H1N1, bird flu, SARS. Those are all just variations of viral breathing infections, okay? And vitamin D, it is incredible. There's a lot of data that shows that vitamin D is particularly important in defending against viral respiratory tract infections. One small little example of this is the epithelium that lines your lungs is a physical barrier between what you breathe in and the inside of your body, and vitamin D is crucial for maintaining that epithelium, that physical barrier, and protecting you. So once you kind of grasp that vitamin D is incredibly important for immune system function, well, there's an important concept that you've got to understand, is that really the protective value of vitamin D lies in having an optimal vitamin D level. See, the optimal blood vitamin D level for humans is 40 to 60 nanograms per milliliter. And if those numbers don't mean anything to you, that's okay. I would encourage you to go to our blog, immunestrongkids.com/blog, and we actually have articles there that explain what the numbers mean. You know, if I say 40 nanograms per milliliter and that means nothing, well, read the article and it will help you understand that. So the optimal range is 40 to 60 nanograms per milliliter. Unfortunately, the average North American, the average Canadian or American has a vitamin D level of 26. Okay, so the average North American has about half as much vitamin D floating around in their bloodstream as they should. And so studies and surveys show us that 90% of people are below optimal in their vitamin D level, and this includes kids. This means 90% of the people you care about and 90% of your children have below optimal vitamin D levels. This means 90% of you watching this video are at an increased risk of sickness and disease. You're at an increased risk of things like cold and flu, and you're not getting all of the benefits that vitamin D has to offer. So key concept here is that to really maximize the benefits that vitamin D has to offer, which are many, the value lies in having an optimal vitamin D level. So how do you know? How can you know if you're protected fully? Well, you have to get tested. All right, a blood test tells you where you're starting. It tells you how you're doing in your vitamin D strategy. A blood test tells you if you're doing vitamin D right or if you're doing vitamin D wrong. And if you're not in that optimal range of 40 to 60 nanograms per milliliter, well, then you're doing vitamin D wrong. Now, you have options for getting a vitamin D test. You can go to a lab and get a blood draw. You can ask your primary care physician for a vitamin D test. We offer a home vitamin D test. And our home vitamin D test is super convenient, super easy to use. It's very affordable. It's typically cheaper than any lab test that you could schedule an appointment and go to. And it actually requires less blood. When I have gone to labs to get my vitamin D tested, they have had to pull out an entire vial of blood out of my arm to test my vitamin D. The home test just requires a little finger prick, and then you just, a couple blood spots on a test sheet, and then you send it into the lab, they test it, and then they send you back your results. Now, so in summary, the value, the most protection that vitamin D offers comes with achieving an optimal vitamin D level. And so this is the key takeaway is vitamin D is one, the immune system vitamin, and then two, the most benefit and the most protection comes when you have the optimal vitamin D level. So the takeaway is I highly recommend you get your vitamin D tested.